An unusually high number of infant deaths have recently been reported in the Milwaukee, Wisconsin area. Some health specialists say many of the deaths were easily preventable if parents hadn't practiced co-sleeping. A new legislation in Lansing is now requiring hospitals to distribute materials to new parents regarding safe sleep practices. But some parents say co-sleeping works for them.
It was much easier because I didn't need to get up and go anywhere to nurse him. All I had to do was roll over.
32-year-old mother of three, Lauren Mitchie, said she and her husband never intended to be a co-sleeping family, but says it's just what worked for them. Mitchie said with her first child, the baby would sleep in between her and her husband with a doctor-recommended sleep sack and no blankets or pillows.
My husband and I felt comfortable with our babies sleeping with us, and we did it in a way that we felt safe with.
When Mitchie's second and third children were born, they too shared the same bed. Co-sleeping can mean sharing a room with your child, or it can mean sharing a bed.
Room sharing is recommended, but bed sharing is not.
Exactly. The American Academy of Pediatrics does recommend room sharing as a way to reduce the risk of SIDS.
SIDS is sudden infant death syndrome. Some health experts claim bed sharing can contribute to infant mortality.
It also increases the risk of death due to suffocation or strangulation.
Even though most doctors, like Dr. Meisel, advise against bed sharing, they support their patients' decisions.
If a family does want to sleep with their infant, I strongly encourage them to do, I think it's just called a co-sleeper, but basically it's a device that attaches to your bed that's sort of like a pack and play, but it doesn't have a side on it that's closest to your mattress. And so it's flush with your mattress, but it's a separate sleep surface for the baby.
No matter your choice, whether to room share, bed share, or neither, there are options to keep your baby safe. There's a national Safe Sleep campaign stating what health officials have found to be the most current recommendations for safe sleep for your infant.
Co-sleeping is a choice that I made for my family because that's what worked for us.
It is important to note that during my research, I found that it is unheard of not to co-sleep with your baby in many countries such as South America, Europe, Africa, and Asia. Those countries suffered a much lower rate of infant mortality. However, the health officials say differences in mattresses, bedding, and other cultural practices may account for the lower risks in other countries compared to the U.S.